Doc, I don't feel very well today, but that's not your problem.
But it is Get Well Wednesday.
It is Get Well Wednesday. And our doctor today is Dr. Sanusi Umar. Did I pronounce it right?
Yes, right. It's right.
He's a dermatologist. And he's certified by the American Board of Dermatology and the American Board of Internal Medicine. A native of Nigeria, Dr. Umar is so respected as the foremost authority in the field of restoring and repairing severely bald cases that people travel across the globe for his expertise. Doc.
Hello.
Doc, are you bald?
Yes. I am. And that's what got me interested in the field of hair restoration.
And your technique is taking the hair from
one part of the
body and putting it on other part. What part do you get the hair from?
Oh, well, typically it comes from the back and sides of the head, where you don't typically go bald from. But sometimes we'll take the hair from the beard area or the chest or leg. If someone is severely bald, that is done sometimes, yes.
Any celebrities visit your practice?
I will not be at liberty to say, but yes, we've seen,
Doctor-patient confidentiality and
gotcha,
all. Yeah.
Gotcha. Good answer, Doc. Good answer. Just checking. So you can take hair and put it in places where there is no hair. Now let's take Whoopi Goldberg, for example, and her eyebrows.
Really? That's who we're going to take?
Yes.
What can you do for Whoopi?
Well, we can take hair from, say, the nape of the neck, where, the hair...
She has no eyebrows?
No, she has no eyebrows.
I never noticed that.
And put it in the eyebrow, yes. We've restored women and men that have that are not endowed with a lot of eyebrows.
Is this procedure painful?
If you do it without anesthetics, yes, it will be.
But you do use an anesthetic.
Yes, you use a local anesthetic, the same type of anesthetic your dentist would use. We don't put you to sleep. We just numb the area by injecting it locally. And you won't feel any pain after that.
And how long of a procedure does this for the implantation and before you see results?
You see results start manifesting from the fourth month, but typically it takes about 7 to 8 months to see the entire results. Yes.
Now, as you know, Doc, or maybe you don't know, I'm bald, and I've been bald for a very long time. So, is there a time limit for transplanting? Have I exceeded it?
Oh no.
No?
No time limit. Yes, you can have a hair transplant to the very last day. Yeah, you can do it. Yes.
I can have hair like Johnny Mathis.
Why would you choose the Johnny Mathis style?
He's got good hair.
He's not talking about the coarseness of the hair, just the fact that you're going to get hair back.
Oh, okay.
I mean, you need to start low, player. You don't want to shock people.
Well, you can even choose for a chair pet,
Can you do anything for LeBron James?
Yes, definitely. We've done something for people that are much bolder than LeBron James.
What's your success rate, doctor?
Success rate is in the neighborhood of 90 and above percent. Almost everybody that does it comes out ahead.
I have a real stupid question. Can I ask a stupid question? Really, really stupid.
Yes.
This is really stupid.
No
I've never
question.
seen. This is very stupid. I have never seen a bald-headed homeless person. Why is it the homeless people have so much hair?
I noticed that too.
That's curiously enough, that's something that I've now that you mentioned it.
Yeah.
Maybe they have. It may also sound foolish to say, but maybe the stresses they have in life is a little bit different from the types that other people have.
I mean, I'm going to work bald-headed, and there's a guy holding a sign with a head of hair.
So maybe he should have a sign, "We'll work for a haircut." Doctor, what about women? Are you finding more women in your practice coming to you for help?
Oh yes, we getting a lot of that, and that usually is because of hair grooming practices. So women, especially women of African descent, because of the hair grooming practices, tend to come down with traction alopecia, which is a condition where you lose hair in the margins and your edges because of constant pulling of the hair from, say, the use of braids, weaves, and things like that.
Doc, with every procedure, there's a side effect. And what's the side effects of your procedure?
Side effect. I wouldn't call it side effect. It's more of possible complications. And that is something you find generally with hair transplants. So you may have some bleeding, which that happens with any surgery. Okay. Sometimes you may get things like pimples in the site of the graft, but that is easily treatable. Most complications of hair transplants are very minor and they're treatable.
Okay, all right. He's Dr. Sanusi Umar. He's a dermatologist. He's talking about hair loss and body hair transplants. If you have a question, just text the question to 646464 for the next hour, and the doctor will answer it. Thank you, doctor.
Thank you.
All right.